And now, fair and balanced as always, Kentucky Democratic Congressman John Yarmuth. He's the senior Democratic whip and a member on the House Ways and Means Committee. He joins us now. And Congressman, I want to put this poll up if I can. This is the latest Rasmussen poll. After the House Speaker unveiled her House plan. Look at this. Supporting the bill, 42%, opposing 54%. That is dramatic opposition.
Well, I think what we faced through this entire debate is, unfortunately, a great deal of misrepresentations, starting with death panels and continuing up to this very minute. The American people, understandably, don't know exactly what's in this bill.
So you're saying the American people just don't get it, and if they got it, they would be in favor of it?
Everybody I've talked to, with almost no exceptions, when I can talk to somebody one-on-one and say, here's what this bill means for you, for instance, if you're a senior citizen, on day one, $500 of your donut hole obligation goes away. You save that money. You get a 50% discount on name-brand prescription drugs, no co-pays for preventative or wellness care. When people understand what's in it for them, they support this bill overwhelmingly. And I think that's what we're going to have to do. We're going to have to just all we do is talk about what the bill does for people, and they support it.
The question is, Congressman, is according to these polls, and that's really all we have to go by, is they don't support the bill overwhelmingly. And I guess the second point would be Nancy Pelosi, the House Speaker, says $826 billion is the price tag. The president says you can't go over $900 billion, and now the Associated Press has crunched the numbers. They've got it at $1.2 trillion. The CBO has the cost over $1 trillion for the gross cost. How do you reconcile that?
Well, I don't know. I don't know when AP became a referee in this. The only numbers we have to go by are CBO's, and CBO says this will reduce the deficit by $30 billion over the 10-year period, and will continue to decrease the deficit past 2019. So this bill saves the budget money over time, and what's most important is that it will help bend the cost curve. We're looking. I get letters from constituents just this week. 32% increase they're experiencing on their insurance premiums 1 year to the next. It's 15% nationwide. We've got to do something to help bring these costs down, and that's what our bill does.
And what do you make of the studies that say that these health care bills that are now in Congress are going to raise premiums and they're going to raise taxes? Do you dispute that? Because almost across the board, I have read no fewer than 8 studies, and every one of them says that premiums will go up, that taxes will go up.
We all know that. But what we're trying to do is make them go up less. Without action, a family of 4 policy is going to increase $1,800 a year for the next 10 years. That takes it up to $30,000 apiece. What the CBO said was that in 2016, a family policy would cost about $15,000. Right now, it costs $12,000. That, to me, is a far better prospect than it costing $25,000 in 2016.
But I thought the idea was to lower
prices are going to go up. Nobody's ever said we're going to bring the cost down.
I thought the idea was to lower health care costs because they are going up so fast. Now we're saying we're going to raise. We know that they're going to go up. We're just trying to make them not go up as much.
Well, exactly. That's what we've been saying from day one. I mean, the president said what we want to try to do is reduce the rate of increase by 1.5% a year. If we do that, we can make it a sustainable system for individuals and for Medicare. That's what we're trying to do. Nobody ever believes we can actually bring costs down, although I will say for some individuals, costs will go down because they'll be able to get insurance for the first time and not be penalized for a pre-existing condition or for being a certain age or being gender. Because females get charged a lot more now than males do.
Kentucky Congressman John Yarmuth. Congressman, thank you, sir.